Hi everyone, Dr. Leigh here from Your Vet Online, and tonight we're going to be talking all about equine wound care. Now, it's one of those topics that everyone's got an opinion about and has a different way of doing things, but I just wanted to go through a few things such as how equine wounds, how you treat them, how they heal, and the things that you must not do when you get an equine wound, because there is a little bit of a problem with some of the advice that I see on a lot of the forums that we have in our, like on Facebook. If you don't know me, I am Dr. Leigh Davidson. Now, I've been an equine vet for 18 years now, and during that time, I've done a lot of work with horses. I've had my own equine practice. I've worked with lots of elite sport horses, whether that's been the racing horses or whether it's been show jumpers, dressage, eventers. I've done a lot of work. So you can be rest assured that I've done my time when it comes to equine work. Right, so I'm just trialing out a little bit of new software here. So if it looks a little bit dodgy, it's probably because I'm not I'm not au fait with using it. But anyway, let's get our show on the road. Let me see. Right, so how do we wounds heal? Well, basically, with all the research that's been going on for many, many years, we actually can't speed up the process. It's about trying to improve the quality of that. So we might, and with equine in particular, as you all know, horses love to produce proud flesh. So yeah, we've got to make sure that when we've got equine wounds that we have them healing really well, but without that exuberant proud flesh that you get with some wounds. So basically, we have 3 stages of wound repair. So the first stage is inflammation, the second stage is proliferation, and the third stage is maturation. So I want to take you through all of these stages. So if we're going to start off with inflammation, straight away when your horse gets injured and there's a big nasty wound, everything, all the blood vessels get in there and they constrict really tight initially to stop that bleeding. However, over time, and this doesn't take very long, they actually start to dilate a little bit. That's the blood vessels, and that's when you get all the little what we call white blood cells, so macrophages, neutrophils, all that sort of thing, hone in there in the blood, and it forms a clot. So we get platelets, form a clot, and you have antibodies and all those nutrients that you need for wound healing all come in. And so basically what we see during that time is heat, pain, lots of redness and swelling, and you also see lots of oozing and exudate, what we call exudate. And often lots of people get worried by how much exudate there is. It's like, is there does that mean that things aren't healing well? Does this mean things are going wrong? Well, no, this is all normal. However, if it's really gross and pussy, that can be an overproduction of exudate, and yes, that can mean there's a problem. Now, we've also got to realize that the difference the way we treat wounds is going to really rely heavily on where those wounds are. So whether they are on just over a mild skin wound, so maybe just the first little skin layer is opened up, whether the wound is over a joint, whether the wound is over a tendon, and whether there's bone being shown. So I'll talk about that a little bit later when we go on to that sort of thing, but it does affect how some things heal and what you see. So basically, remember, when you have all that exudate, it's not to be scary, you know, don't be scared of it. Basically, it's telling you that all those cells are honing in there, and it's the body's response to inflammation. And basically, the body's doing its job correctly. Now, the next stage that we're going to talk about is proliferation. Now, this is the stage that is really important, and it basically means that new tissue is growing. And it's the most crucial part of wound care. You get this wrong, then your horse or your dog, your cat, yourself, it's going to take a lot longer to have a beautiful, strong, well-healed wound. So basically, this process starts about 8 to 10 hours after the horse has injured itself. And basically what we're seeing is epithelial cells that move in and come over the wound and form like a matrix, and it's all about healing, and that is so important. And basically those cells are what are basically going to be oh dear, what's happened? It's got a bit cloudy. Oh, sorry, Angela, I was looking at that. I thought you meant my picture was cloudy. No, so I'll just show Angela's comment there. And basically she's asking whether clear is good, cloudy or pussy is not. No, that's not what we're saying. It can be cloudy and it can be pussy. What is, because when we get back a little bit further into the talk, I'll talk about how long we leave bandaging on for, and often you'll remove it and it might look pretty gross, and oftentimes that's not a bad thing. It's nice and moist and it means the body's doing its job. If it's got to the stage that it's really oozing, like you get so much discharge that you are having to change bandage every day, huge amounts, that's bad. So I don't know if that explains it properly. Now, Meredith asks, is proud flesh skin? So no, proud flesh is exuberant granulation tissue. And so basically it means that, yeah, it's something that's quite specific for horses, and it happens when our good epithelial tissue goes out of whack, and basically it makes huge, big, bulging areas of what we call granulation tissue. Now, normal, healthy granulation tissue, it doesn't bleed, and it's a nice light pink color. But when they get this horrible proud flesh, basically it's often darker red. It can be, it often cracks. It can bulge out from the skin. And the thing is, our little skin cells, which are on the edge of a wound, can't get over, I like to think of it like a mountain. They can't get over the mountain. So that's why we've got to, in horses in particular, because other animals don't really get this, you've got to trim that back and make sure it's kept totally under control. So I hope that answers that question, Meredith. Right, let's see, and then we'll keep talking, but I just want to move through the stages of healing. And our next stage is maturation. Now, once the wound has closed over with skin, you actually, this can take a really, really long time to actually build up what we call the tensile strength of that wound, and that's the scar tissue. And we're trying to get it so that when we have that scar tissue, the linkages are nice and tight, and you're not getting, you know, they're not going to rip apart and break open when there's issues, you know, like maybe if the animal, like some of those wounds that are on the front of a cannon bone, you know, like they can be quite firm and quite tight. So the better we can get that healing proliferation stage, and the better that forms and the better that maturation stage is, so that it's, the linkages are really good and tight, then we're not going to have them split open. Because sometimes what we notice, if it's a poor wound contraction and it hasn't worked, like the animal maybe is a bit immunocompromised, or it just for some reason hasn't healed properly, sometimes you'll see scars that occasionally split and bleed, and then you've got to have that healing process happen again. So this was when I was going to talk about proud flesh. Meredith got in to start with, but basically, just to recap that, it's when there's granulation tissue that basically goes bonkers. Like, it seriously, it just goes mad, and it forms all the way over the top of the wound, and it makes it really, really hard for skin and epithelial cells to get from the side. So one of the most important things we want to do is actually keep proud flesh at bay. And I really want you guys to listen to this, because one of the things, we don't know why proud flesh occurs as such. There's a few ideas, and basically one of them is that it's prolonged inflammation. And so when there's prolonged inflammation, then the wound delays healing. Now, horses for some reason seem to have a bit of a weaker immune system and an immune response to initial injury than lots of other animals. So it might be something to do with that. And often especially in the lower limbs, which is where we see this, there's actually less oxygen levels, and oxygenation is really important for wound healing. And so the fact that there's less in that area, that's one of the main issues. Also movement. Movement plays a major role in proud flesh formation. So when you think about it, you've got a lot of horses, when they get injuries over a joint or over, say, the front tendon, in particular the extensor tendon, you often see a lot of proud flesh, because that tissue is moving all the time. So yeah, just beware that proud flesh formation loves inflammation, and it loves movement, and yeah, so those are the two major things that we've really got to think about when we want to prevent it. So sometimes I wouldn't say that we can actually totally prevent proud flesh. I would say that we can minimize it. And one of the things to do when you've got horse wounds is you want to try and make sure that we've got those epithelial cells, which are the ones we want from the outside, creeping over, and we want them to be looked after really well. Like, we do not want to destroy those. So let's think about it. We've got infection. So those little epithelial cells do not like infection. We don't like drying out. Another word for that is desiccation. So you've got to try really hard to keep that wound nice and moist. Those little epithelial cells don't like proud flesh, so, you know, the whole thing. And they don't like the extreme cold. So those are the key things that we think about when we have trying to minimize proud flesh. So what I'm going to talk about now is we're going to go through what we should do for our immediate wound care. Now, I want you all to be safe. One of the things often with horses is that, hey, they kick. So whatever you do, don't put yourself in a situation where you're going to actually be injured yourself. Be very careful. Sometimes it's a good idea. You can have somebody hold the horse and another person can hold an opposite leg up, something like that, just for you to examine it. But yeah, just always have your safety at first, thought. And also, if your horse is sick, and this is in particular for the Australians here, and if you're in a Hendra area and you're unsure what's been, like you haven't got your horse vaccinated for Hendra, just be very careful, because remember that horses with Hendra virus often have neurological issues and can fall over and hurt themselves. So we've always got to keep that just at the back of our mind if we are in a Hendra area. So number one, and my favorite saying, is basically the solution to pollution is dilution. So if you've got a hose and you can drink the water out of that, you just get in there and give that wound a really good hose down. You don't have to be fussy. You don't have to be too precious about it. Ideally, it's got to be drinkable water. Like, we do not want to be putting dirty dam water or anything like that onto a wound, because that potentially can make it worse. Also remember, if there's anything that's over a joint, please, you must get a vet for those ones, because joint infections are a major medical emergency. And I've been in situations where the little nick is so tiny, yet the joint got infected. So it can be a disaster. Right, so what we also have got to think about is cleaning that whole area up. Now, I love to use clippers, but you might have just a little shaver and get rid of all that hair that is all around the wound edges. You don't want hair in the wound. You can cover the wound with some sort of KY jelly, some sort of lubricant to try and catch the hairs. But even if you just give it a good clean up, that will be fine afterwards. I often use, now some vets might go, oh, but when I used to work in a specialist equine hospital, we did this, so I've always done it. But you can scrub very lightly with those special medical scrubs. You can get chlorhexidine ones and you can get betadine ones from your veterinarian. And they're a really nice soft brush, and there's a sponge on one side and little bristles on the other side. And often you can just use the sponge, or you can use the bristle side, just very, very lightly to try, because remember, horses usually do this out in the paddock. So it's going to be filthy. So the better you can clean this, yeah, the way better that it's going to be. Now, I love doing that, and I always finish off with either a chlorhexidine wash or a bit of a betadine wash. And make sure it's really dilute though, because we don't want to kill any of the good little epithelial cells. We want to encourage them to all do their little migrations and move over the area. And some of those products, I'd leave them for later, like not to use them so much, because they will kill epithelial cells. Now, let's have a little talk about creams and potions. Now, I hear a lot of people wanting to put this and put that on their horses' wounds. It's really funny, because basically the way I see it, it doesn't matter what you put on a wound, pretty much if it's moist and it's pretty inert, and by that I mean it's not caustic, it's not a clay, it's not dirty, and it's not a steroid, you're actually going to have a healing wound. So you want to use creams and potions that are going to promote epithelialization. Now, you want it clean So to get good wound care, you want a clean wound, and you want a healthy wound, and you don't want to encourage any sort of infection. So that means none of those caustic, horrible wound powder things like yellow lotion or anything like that. No, 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 no. In the initial stages, so bad, not funny. Like, please do not use those things. And my favorite, here we go. Do not use clay and poultice on wounds. Sorry, I just do my head in with all the advice that you hear about people recommending, even some of the companies recommending that you put clay poultices on a wound. Guys, these are dirty. You think about, they are great products for everything else bar a wound. They're dirty. You put your hand in there and slap some on, and then you put your hand in there again, and you're transferring, I don't know what, into that. And most importantly, they dry out wounds, and they don't let that wound have oxygen, and they do not promote healing. So what are you going to get if you use clay poultices on a new wound? Basically, you're going to keep it infected, and you're going to prolong the time that it takes to heal. You're going to encourage proud flesh, and it's not that we speed up wound healing, but you're not going to have a good wound healing situation happening. So yeah, avoid that as well. The other one that I particularly don't like are steroid-based creams. I know a lot of people do, and a lot of vets do. I personally avoid those. Steroids on wounds delay healing. So I'm not a fan of that. So that's all our things like the predniderms and all those sorts of type of products. Like I'm not personally, I'm not a fan of that. What we want to do is we want to promote healing. So when we promote healing, we want to keep, again, remember, we want to keep it moist. We want to promote oxygenation, and ideally we want the wound to be as still as possible. So, Manuka honey is often touted as one of the good things. I'm not sure how much relevance having Manuka part of it is, because honestly, I've seen people slap just normal honey on. Now, I'd be very careful with that. Especially if you've got tendon injuries or injuries around joints, around tendon sheaths, you'd want to be very careful what kind of products you put in those areas, but you should be talking to your vet and having a consult if you've got those issues. And they can advise what they think is best there. But yeah, honey's a good one. I'm a great fan of Paranet gauze and melalin, putting that over with a whole heap of sulfur diazine on it. That's really good for infected wounds, and it's really great for burns as well. A lot of patients that we look after who have had severe burns, we use sulfur diazine. There's products called Intragel. That's another one that's a great wound healer. But remember, what we're doing is we're keeping the wound moist and oxygenated and hopefully still. So that brings us to bandaging. So in the early stages, when we're trying to get that wound to heal over, basically you want to try and prevent as much movement as possible, and you want to keep it clean and moist. I often recommend that we don't change bandages any more often than every 5 to 7 days. I know a lot of people gasp in horror at that, But it's actually, the more you change a bandage, the more you're actually ripping those beautiful little cells that are trying to creep across, you're ripping them off and you're disrupting that environment. So we really want them to be migrating over and having a good old time. So yeah, definitely, definitely need to do that. Now, the other thing is I would be, changing the bandage every 5 to 7 days. If it's copious exudate, and I mean it's dripping through that bandage, yes, of course you're going to have to change it, but try and keep it off as much as possible. Keep it on, sorry. Now, I also am a firm believer that often we bandage for far too long. Once you start getting proud flesh, a lot of the times we can remove the bandage and leave it off, trim that all that proud flesh off, and basically it promotes and helps those little cells get over the top of that area and heal better. Some people recommend using like caustic lotions. If you're going to do that, your things like your yellow lotion or copper sulfate, make sure that it's only in the middle of the wound and not near the edges, because we want those little cells to come over and form a barrier. And I honestly believe that a lot of people stuff that up, and that's why their horse wounds take forever to heal and don't have great results. So yeah, keep those caustic lotions away. Definitely keep the poultices and the clays away. And yeah, once you're starting to get once everything's covered over, especially if it's a bone has been exposed, sometimes you don't actually need a bandage. And I find that bandaging sometimes promotes proud flesh in those instances. So our final roundup for what we've got to talk about, and if you've got any questions, but basically we want wounds to be kept moist, we want to avoid infection, and we want to contain and remove any proud flesh that forms. And whatever you do, don't forget tetanus vaccination, because we don't want our horses getting sick from that. So has anyone got any questions? And I hope everyone can still see us. I'm using this new this new system, so I'm not even sure if it's going to cut out on me, because I think it was only meant to be for 20 minutes and I was just trialing it. So yeah, but basically wound care is pretty easy. I think a lot of people stress a lot about it. Wounds heal, and it might take a while. I'm a great lover of nappies, and I'm a great lover in women's sanitary pads to use as use as wound covers. Sometimes using stable wraps with a nappy underneath can be a cheaper option for you, especially when you've got a lot of exudate. But yeah, I hope that's been helpful to you. Get rid of that clay poultice. I don't want to hear anyone recommending that on forums again. Honestly, every vet I know nearly has a coronary every time we read that. And then we get the blame for why wounds don't heal. It's kind of frustrating. But anyways, guys, anyone got any comments? Otherwise, I'll round this up now. No? All right then. Well, I hope you have found that interesting. Make sure you head over to the website. This is all outlined in that article, and so you can read a little bit more there. We're always available at Your Vet Online 24/7. If you can't get your vet out to you and you've got a horse that's injured themselves, we're able to help you, because we can look at this on video and advise what you need to do right there and then, And yeah, it might help you if you can't get your vet out, and we can advise the steps to take to try and help you through those initial stages. Yeah, so always remember us, guys. Our links are on our website if you ever need us. And what has Angela written here? Let me have a look. Cool. I'm having trouble keeping the bandage on, but cleaning each time before I rebandage. Okay, yeah. I mean, if it's covered, if all the bone and the tendons and everything like that are all covered up, maybe you can stop the bandage. Often we honestly leave the bandaging going for such a long time, and it's so expensive, guys. Like I tend to take them off, and honestly, I don't have the problems. I do cut off a lot of proud flesh. Now remember, there's no nerves in proud flesh, so you don't have to, like, I wouldn't be doing it yourself. Get your vet to do it, because if you cut the edge, then you'll get a boot in the face, and that has been done before too. But definitely, I honestly think some people bandage for longer than they really need to, and once all that area is covered, you can even just use Elastipast, sometimes just to hold everything, like if you have a little pad on the wound and put a bit of Elastipast around it. There's been some studies actually out of New Zealand that used to put Elastipast directly on the wound. I've tried that a few times. Honestly, it worked. I didn't see any difference from wounds that I didn't do it to wounds that I did do it to. All I know is how expensive it is sometimes with all the bandaging material. So I try and do things as cheaply and as economically as I can, because yeah, let's save some money. But anyway, I'll let you guys all go. Thanks for joining us. I'm Dr. Leigh from Your Vet Online. If you want to get in touch, our website is www.yourvetonline.com, and give us a like and share this if you think it was any value. I'm sure all your friends would love to get upskilled a little bit. And next time I'm going to try and do it and have pictures, because I tried to do that tonight and I failed. So I'm sorry about that. But head over to the website and you can take a look over there, and we'll talk to you all later. See ya. Bye.